Good afternoon, class and instructor. My name is Abby Johnson, and I am going to be presenting my suicidal PSI preventative protocol to regard about suicide prevention among young veterans and active military. Suicide have been on the rise among our young generation and have continued to destroy our young generation in society. Suicide occurs when a person chooses to end his or her life. It is defined as self-inflicted injury or body injury within from a person that leads to their death. Suicide among veterans have been a concerning public health issue. According to the Veterans Association, suicide is among approximately 17 U.S. veterans die by suicide every day. It is the second leading cause of death among people ages 10 to 14 and 25 to 34. Among veterans, it is between the ages of 18 to 35, and this age range have experienced higher rates of suicide at all ages and all genders. According to this Veterans Affairs, about 76% of young veterans commit suicide between 2005 and 2017. Veterans are our concerns. We as society need to take this very seriously. Suicidal thoughts and behaviors are the greatest predictors of suicide. Within the average age range, about 52 per 100,000 men commit suicide and 22 per 100,000 women commit suicide. In 2010, the Department of Defense announced that 365 active duty officers, both Air Force, Marines, committed suicide or died by means of suicide. What are your risk factors that needs to be observed within this population? Most people die of suicide have been suffering from mental illness such as anxiety, depression, bipolar. These people go through their struggles with their mental illness, which then lead to their suicidal thoughts and lead to their suicidal death. Many veterans suffer from suicidal thoughts are isolated, are due to addictions, economic instability. A lot of veterans come when they get their pension. It is not enough to support them in the society, and sometimes that can lead to a lot of frustration from them. They develop housing issue or insecurity. They are very stressed out, and even culture, our society as a whole have suppresses or neglect our veterans. Many young people that deals with mental illness struggles with transitioning into our current civilian life. They they deal with the stressors, just in general life stressors. They are sad. Most of them are lonely. They're angry and they're just upset. They're upset with the world. They're upset with their family, they're upset with society because they have given their lives to fight for this country. In some cases, many have or previously had previous trauma, whether it's sexual, physical, neglect, emotional, or environmental factors that may contribute to their mental illness. Other causes include poor coping skills that is um, very important for people or veterans that are having suicidal thoughts. They tend to get involved into using drugs and alcohol, which can then lead to depression and have suicidal thoughts. So what are the warning signs? And these are warning signs that we all need to actively pay attention to. What are family, friends, healthcare providers? We need to pay close attention and reach out our hands to these individuals. They experience sleeping difficulties. They give away personal and prized possessions. Excessive or increased use of alcohol or drug use that is beyond their normal. Talking about or not wanting to be part of today's society, taking risky behaviors, can all lead to the warning signs that we have to watch out for. Individual feeling intensely sad are important. So I decided to kind of dive a little bit within the state of Texas and see how the veterans within the state of Texas um, are when it comes to suicidal rates. As you look, most of it is similar to the national average database, and it's similar to the age ranges that are within that are nationally provided through the Department of Veterans. Within the Veterans organization, the VA have provided a safe training that providers, family members, community resources can take. It's called SAFE. SAFE are warning signs of suicidal thinking should be recognized. Ask the most important question of all. Are you thinking about hurting yourself? Do you want to kill yourself? These questions are not questions that should be shy away from. These are questions that needs to be asked. If we do not ask, we will not know. Validate the veteran's experience. Encourage them to go to treatment centers. Encourage them to get help. That is very important. Um, I came across this um, algorithm for providers to use when it comes to interacting with veterans. And I find this to be very helpful, and I think it will benefit a lot of veterans. Providers, these are some of the things that we need to do. I apologize. To address some of the issues, we have to kind of strengthen access to suicidal thoughts within our community, suicidal care, provide coverage for veterans with mental health needs, improving the shortage of providers within our veterans community, identifying warning signs of crisis within our veterans community, promoting connections. Community engagement is very important when it comes to getting our veterans the help that they need. Creating a protective environment. Create a safe haven. Who do they go to for help? Who can they talk to when they are in need? Who is the number one person that they trust? These are very important for veterans to have in place. And as providers, we have to enforce that they have these in place. Identification of social support with friends and families. Provide crisis resources such as the suicidal hotline, lifeline, the veterans hotline to veterans, and allow them to know that there are resources, there are places they can call that are confidential, and whatever it is that is discussed will not be discussed with others. Provide counseling sessions, psychotherapy sessions, such as cognitive behavior, problem-solving skills, or problem-solving therapy, and diagnostic. This list is different resources that are available to help and support the veterans community. As you can see, there's the Family Guide and Support Military Resources in Crisis, and that's their link. Restoring Hope for Veterans, Military Crisis Line, Veterans Crisis Line, and of course, Suicidal Crisis Line. And if all else fails, call 911 and get them the help that they need. Remember, everything that is discussed is confidential. This is the suicidal hotline that can be used nationwide for veterans and for our community as a whole to use to get the help that they need when it comes to suicide. I've included some of my references that I used to discuss in this presentation. Thank you for taking to listen to me, and I hope you enjoyed my presentation. You have a wonderful and blessed day.